The distinctive pink-red sandpaper rash, flushed face, painful throat. Hello mommies and daddies, and welcome again to Raising Happy Children. I am a pediatric nurse practitioner working in the UK, so you may be very well aware that there are high rates of scarlet fever. Scarlet fever is rapidly increasing, especially in children in the UK today. So in this video, I am going to talk about scarlet fever or group A strep and some of the things that you can do at home to help your child to make a very fast recovery. Possible to prevent the complications of scarlet fever, which can be dangerous to children. Group A streptococcus is a bacteria which can colonize the throat, skin, and nasal tract. It causes a diverse range of soft tissue and respiratory tract infection, and scarlet fever is just one of them. Scarlet fever is much more common in children than in adults. So it's very important that you take note of the signs and symptoms that you need to look out for in your child so that you can seek medical advice as soon as possible. Your child may have a high temperature, the distinctive scarlet fever rash, throat. Sore throat is very, very common, painful, swollen glands in the neck. The rash of the scarlet fever often much harder to see on darker skin. Starts with small spots on the body, then spread to the neck, and then the arms, and then the legs. And this can happen over 1 to 2 days. If you rub your hands on the rash, then it will feel a bit like sandpaper, rough to touch, and it will be very itchy for your child. They may also experience peeling of the hands and toes. We will now take a look at the treatment for scarlet fever in children. It's very important at this point that I explain to you that group A strep has always been around. It is not a new thing. And for many children, Strep A infections are mild and will clear up on their own. But for others, it can be serious and even dangerous and life-threatening. Children are especially at risk of complication, so it's best to see your doctor. Unfortunately, a few deaths in children. So it's very important that you know how to treat this infection at home so your child will be given antibiotics by your GP to reduce the risk of infection and also to reduce the risk of your child having major complications of group A strep. So it's very important, as soon as you spot the sign of scarlet fever, you should take your child immediately to see a doctor so that they can start on antibiotics as soon as possible. So, unlike the flu, which is caused by a virus, your child will need antibiotics, oral antibiotics, to prevent complications. Scarlet fever, which is caused by a bacteria. How long will your child's symptoms last? Of course, all children are different, but your child will be better 24 hours after starting treatment with prescribed antibiotics. So, what should you do? Your child will need antibiotics, oral antibiotics. You would want to make sure that your child has taken all of the prescribed antibiotics. Even if your child feels better, please do not stop. Continue to take all the antibiotics until your child finishes the entire course. The antibiotics will reduce the amount of days that the fever lasts, also the sore throat paracetamol and ibuprofen can help to relieve the symptoms of the headache, sore throat. Use paracetamol and ibuprofen to help with the fever. Use paracetamol. Your unwell child may not want to eat, and that's perfectly normal. It's very important that you do not focus on the eating so much. What you want to do is to prevent your child from becoming dehydrated. You can do this by offering your child small amount of fluids often. Talk to your doctor about a special spray called Deflam spray, because this spray can help to smooth your child's sore throat. Ask your pharmacist about antihistamine to relieve the itching. Remember as well, children can get very ill very quickly. So there are certain times when you should contact your emergency service 999 if you are in the UK. So if your child is pale, have molted skin, feels abnormally cold to touch, has blue lips, too breathless to talk, eat or drink, has a fit or a seizure, is extremely irritable, crying, inconsolable, and has a rash that does not disappear when you press pressure on, then you need to seek medical advice immediately. I've seen many children in my career come into hospital for treatment for scarlet fever and group A strep. But at this point in time, there is an increased number of group A streptococcus in the community, and as a result, more and more children are being affected by scarlet fever, and we have also, unfortunately, a few deaths in children. So it's very important that you know how to treat this infection at home. It is sometimes very difficult to tell if your child is unwell, but you know your child best, so trust your instincts. So, if for any reason you have found this video helpful, please don't forget to give me a thumbs up, like, subscribe, and help me to reach 500 subscribers. Until next time, goodbye.